Hi, I'm Dr. Antimarino. I understand you want to talk about a possible breast reduction.
Yes, I do. Can you give me a little bit more information about it?
I'd be happy to. Breast reductions are one of the most common procedures that I do from an insurance standpoint, and it's a great operation. There's few operations that are accepted by almost everybody that gets it, and they can be life-changing. Many women come in and they don't even realize the amount of pain and discomfort they've been in for the last several years or decades, depending upon what age they approach. But it's an operation that can be across the board for any woman at any age. I've had some women into their late teens all the way up into their early 70s. One of the most common things women say to me after they've had it is, "I wish I had done this sooner." The complaints prior to surgery is most women are having breast pain, shoulder pain, upper back pain, neck pain. The other thing is a lot of women are getting rashes below the breast and even between the breasts because you're trapping moisture and heat, and that skin-on-skin contact causes that rash, and a lot of women complain that not only does it hurt, but it also smells. Another thing that's kind of subtle that women don't even associate with having large breasts is that a lot of these women get tension headaches. And it kind of goes along with the shoulder grooving they get from their bras. What happens is the breasts are very large and dense and pendulous, and so you're using your bra more as a hoist rather than a support garment. So to do that, you cinch down on the straps of the bra, causing more shoulder grooving. That causes a spasm of the muscle that runs up the back of your neck called the trapezius muscle. So for many women that I've done breast reductions on, they miraculously seem to have their headaches go away as well. So I never promise that, but I usually tell women that there's a good chance that can happen. Now, breast reductions is a procedure that sometimes, but not always, is covered by insurances. It was a procedure that was always covered by insurances up to just about 2 years ago. So we'd have to check your insurance company. Now, that being said, insurance companies want certain criteria to be met now. So some of the things that they want to have documented, not just by me as the plastic surgeon, but by your OBGYN physician or your primary care physician, is that you have a history of a rash. You have a history that you've been using prescription strength antifungal or hydrocortisone creams. You've had a history of having to use non-steroidal anti-inflammatory medications such as ibuprofen, Motrin, Aleve, even Tylenol, but anything conservative. They also want you to have at least been evaluated or undergone treatment protocols from a chiropractor or even a therapist for strengthening exercises. So things that you've tried to do to alleviate the problems that you're having without surgery. To undergo a breast reduction, the incisions are classically circling the areola. Then there's the vertical part that runs from the areola down to the fold of your breast and then along the fold of your breast, so almost like an anchor type of incision. Those are the classic incisions. They can vary slightly depending upon the type of breast reduction that you get. The incisions are long, but they tend to heal beautifully. Post-operatively, most women feel better right after the surgery. Some women say right in the recovery room or by the next day they feel like the pressure is off their shoulders, the pressure is off their back, and so they're already feeling better. So most of them are back to work in about a week and a half, depending upon the type of job they have. I hold them out of exercising and housework for 3 weeks because I want the incisions to heal well. After that, you can get back to most of your exercising, back to some more normal activities. By 6 weeks, you're back to everything you want to do. I do send the breast tissue off to be looked at by a pathologist, so there's a pathology report involved as well. But overall, it's a great operation, well tolerated, and one I really enjoy doing because it's, like, as I said before, life-changing for most women. But that being said, have I answered all of your questions, or is there something that you don't understand?
No, I think that's all. Thank you.
Bellissimo Plastic Surgery, your partner in defining you.